Hi, everyone. This is Tom Madger from AACP. Thank you so much for joining us for today's session. We're going to get started in 1 minute. Thank you. Hi, everyone. We're going to get started with the session shortly. Terry, would you be able to begin recording? Hello, everyone, and welcome to the CE webinar. I'm Tom Madger from AACP, and along with Dr. Sharon Rush, we will be moderating today's events. We'll get started with today's session. It's all about trust, a preceptor's guide to EPAs and experiential education in just a moment. Now let's take care of some housekeeping. Attendees, I would like to introduce you to the GoToWebinar interface. There is a questions feature in your control panel. You will be muted the entirety of the session, so please feel free to ask any questions in that window. Technical questions will be addressed as they come in, as well as logistical questions, but we will save all content-related questions for our panelists during the Q&A session at the end of the presentation. Second, in order to claim CE credit from this live presentation, you must stay for the entirety of the session. An email with the CE processing information will be sent out after the conclusion of the webinar, and we will also display the CE slide once the recording has stopped. Also, we will make sure that we send out instructions to claim CE credit from the recorded version in case you aren't able to stay the full time, but we will have multiple options for you sent out afterwards. Now, I will turn it over to Dr. Rush for introductions.
Thank you, Tom. Well, welcome everyone to It's About Trust, and we are really excited to present this webinar. We are part of the Preceptor Development Committee with AACP, and we would like to thank AACP for all of their help and their gracious support in making this particular webinar possible. I am Sharon Rush. I will be your moderator for this session. We do recognize the importance of you as our preceptor of seeing our students in action. A lot of times we don't get to do that as faculty, and so we really rely on you to give us a very good, accurate assessment of our students and how they may be as an actual pharmacist once they graduate from us. And so we hope that this webinar will give you a little bit more information and tools to use to help with that. Again, like Tom said, you can submit your questions throughout. We will go through our entire presentation, and then at the end, we will have a Q&A time frame where we can hopefully address a lot of those questions. So I'd like to go on, and if we could get the next slide, please. I would like to introduce our team. And again, like I said, I am Sharon Rush. I'm from the University of Texas at Austin College of Pharmacy. I am a clinical associate professor with the Division of Pharmacy Practice and the Community EPA coordinator. I am also co-coordinator for the P1 Pharmacy Practice Lab sequence and chair of the Pharmacy Practice Lab Committee. I'd now like to turn it over to Amanda.
Hello, everyone. My name is Amanda Loya, and I'm the Associate Dean of Community and Clinical Programs at the University of Texas at El Paso. And in my role as Associate Dean, I oversee our Office of Experiential Education.
Hi, my name is Corinda Field. I'm a Clinical Associate Professor at the University of Florida, where I serve as the Associate Director for our Office of Experiential Programs. And there I oversee our team of regional coordinators and oversee our preceptor support and development initiatives.
Hello, everyone. I'm Dr. Erin Johansson. I'm the Director of Experiential Education at Roseman University's College of Pharmacy. I've been there for almost 13 years now and teach in all years of the didactic curriculum and oversee both the IPA and APA rotations that our students are on throughout the curriculum. Happy to be here today.
My name is Stacy Reed. I'm the Assistant Dean of Experiential Education at the Medical College of Wisconsin in Milwaukee, Wisconsin. I've been in my role about a year and a half, and I oversee all of the IPA and APA rotations for our students.
Okay, thank you, Stacy. And if you could advance to the next slide, please. Okay, these are going to be our learning objectives for the day. And so basically what we're going to do is introduce you to COEPA and the EPAs and the level of entrustment scale. We're going to kind of look at those target levels, go through some introduction of that. We will cite some examples of how some of us are incorporating the EPAs into our student evaluations. And then we're going to give you a little chance to be interactive with us and apply the levels of entrustment to the example learner situations. And again, if there is a handout that you can refer to, and please refer to that. We have several things. It will have the entrustment scale, and it will also have some of the polling questions there. So next slide, and I am going to turn this over to Erin.
Hi, everyone. So in academics, faculty members, preceptors are often using a lot of acronyms, especially when we talk about standards, accreditation, curriculum. So I'm going to try and use the time in the next group of slides to provide some history of what entrustable professional activities are and how they're used on students' IPA and APA rotations. So this is at COEPA 2022 is actually the 5th version that the Center for the Advancement of Pharmacy Education, also known as CAPE, has put out. So this has been almost 3 decades worth of work that has come out. What educational outcomes are, and those are in both our didactic classroom activities and offsite at practice sites, are the knowledge, skills, and attitudes of pharmacists that we want students to demonstrate upon graduation. So as you can see on the next slide, entrustable professional activities are actually something that's come from medical education. They were, and COEPA did one version in 2016. So as you may know, we want students to meet educational outcomes in the classroom to provide some knowledge, skills, and attitudes that they then will demonstrate in practice at our sites. So the EPAs are things that need to be observable and things that preceptors can identify their level of entrustment with. So on the next slide, you'll be able to see some revised EPAs. And again, don't worry about the numbers, don't worry about the domains. Think about the subdomain or one-word descriptors. So each of these revisions has tried to simplify and clarify what tasks are observable in practice sites that preceptors can utilize to evaluate student learning. So when you look at one-word descriptors like learner, problem solver, communicator, collaborator, leader, professional, we're hoping that preceptors are able to then look at those things and say, okay, is my student professional? Do they have the behaviors that embody, the qualities that I would want in my colleague or my peer? Do they communicate in a way verbally and non-verbally that's appropriate when they're interacting with patients or other healthcare providers? So this revision was really intended to be able to move towards the descriptors that preceptors can evaluate. So when we go on to the next slide, these one-word patient care provider, interprofessional team member, population health promoter, all of these, you might have an idea of what they mean in your mind, but what we've done in the EPAs and in most of the rubrics that we're going to show you from our various institutions later in the presentation is describe those in activities. So when we move to the next slide, these are specific entrustable professional activities. So that means that they are tasks and responsibilities that students are entrusted to do. And these things could be with indirect or direct supervision. So when we want a student to graduate, their PharmD degree should mean that they are capable and competent for entry-level pharmacy practice. And what that means is they need to be able to demonstrate these activities in a way that can be evaluated by preceptors to describe their level of trust. So when we look at that cute little wheel on the right-hand side of your screen, that's the pharmacist patient-centered care model. It's a wheel, and the color-coded areas link back to those entrustable professional activities. So if you hear people at your College of Pharmacy talking about the PPC wheel and CAPE and ACPE and all of these things, what we want to be able to do is put this in a way that preceptors in practice can identify in the tasks that they complete on a daily basis. So we're going to go through these in the future, so you can go ahead, and at this point, I'm going to move on to my colleague Amanda to talk about levels of entrustment.
Thank you, Erin. So now that we've had a brief introduction to COEPA 2022, let's begin our discussion on the levels of entrustment that are used to assess EPAs. Next slide, please. So entrustment refers to the level to which a learner can be trusted to perform the EPAs and their supporting tasks. And this level of trust should develop over time, and it'll be a reflection of the depth and maturity of the knowledge, skills, and attitudes of each of our learners. And fortunately, scales have been developed to help us as preceptors to identify the level of entrustment for our students. Now, the EPAs and the entrustment scales that we use to evaluate them help us as preceptors to start with the end in mind. In other words, what should our pharmacy graduates be able to do when they enter into practice? Next slide. So the first entrustment scale for pharmacy was proposed by AACP in 2016, and it was based on the Ottawa scale, which was originally designed for medical residents, and then it was extrapolated for use with medical students. And the original Ottawa scale proposed 5 levels of supervision that were needed for a learner in a clinical setting. And with this original Ottawa scale, entrustment is viewed as a continuum that begins with the learner's ability to only be able to observe activities being performed by others, and it ends on the other end of the spectrum with the ability for the learner to be able to supervise colleagues. Similarly, the 2016 AACP levels of entrustment scale adopted 5 levels of entrustment, which are shown here on this slide. So you can see level 1 is observe only, level 2, direct supervision, level 3, reactive supervision, level 4, intermittent supervision, and level 5, general direction. And we will be exploring these levels in more detail in a few minutes on the upcoming slides. Next slide, please. So as I mentioned previously, the original Ottawa scale was developed for medical education, which does require postgraduate residency training. Now, as we apply this to pharmacy education, we recognize that postgraduate training is not mandatory, and pharmacy practice laws may restrict the ability for students to perform certain tasks independently, which would occur at levels 4 and 5 on the entrustment scale. So in the spectrum of pharmacy education and practice, pharmacy students would only be expected to reach the 3rd level by the time they graduate with their D degree. So in other words, all pharmacy graduates should be able to perform the core EPAs and the supporting tasks with reactive supervision, which is a level 3 on the entrustment scale proposed in 2016. Next slide, please. Now, when COEPA 2022 was released, an updated entrustment scale was included. And in this edition of the scale, the numeric level was removed to allow preceptors to just focus on the descriptors of the level of entrustment versus the numbers themselves. And it is possible for students and preceptors alike to sometimes focus on achieving a certain number or level during an evaluation. So it's helpful for these numeric values to be removed so we can really focus on the descriptions. Now, using this scale, we as preceptors can then provide EPA-based formative feedback to help our learners. And once again, the goal level of entrustment for students upon graduation is reactive supervision. Next slide. So now that we've had an overview of entrustment and the 5 levels, let's take a look at the details of the entrustment scale provided by COEPA 2022. Now, this scale can be found in the handout that has been provided to you. So let's look at each of the levels. For learners who are at a level of observe only, that means the learner is only permitted to observe an activity being performed by others. Even with direct supervision, the learner cannot be trusted to perform the activity or task themselves. At a level of direct supervision, the learner is entrusted to perform the activity or task with direct and proactive supervision. That means that they must be observed performing the task in order to provide immediate feedback. At a level of reactive supervision, the learner is entrusted to perform the activity or task with indirect and reactive supervision. So that means that the learner can perform the task without direct supervision by their preceptor, but they may request assistance. And the supervising pharmacist preceptor is quickly available on site. They can step in and assist as needed. And then the preceptor can provide feedback immediately after the learner completes the activity or task. At a level of intermittent supervision, the learner is entrusted to perform the activity or task with supervision at a distance. So the learner can independently perform the task, and the learner only meets with a supervising pharmacist at periodic intervals. Feedback is then provided by the preceptor regarding the overall performance of the learner based on a sample of their work. And then at a level of general direction, the learner is entrusted to independently decide what activities and tasks need to be performed. So the learner can also be entrusted to direct and supervise the activities of others. And the learner only meets with a supervising pharmacist at periodic intervals, and then feedback's provided regarding their overall performance based on broad professional expectations and goals of the organization. So once again, the goal level of entrustment by the time a student completes their PharmD degree is reactive supervision. And it's important to note that this is a minimum level of entrustment. This does not mean that this will always be the desired level of performance, since it's possible that colleges and schools may require their graduates to perform certain EPAs with intermittent supervision. And we do have situations where we're working with extraordinary students with extensive work experience, and they might be able to perform certain EPAs under general direction. But it's unreasonable for us to expect that most new pharmacy graduates are going to perform at this level. However, new graduates should no longer require direct supervision. During the second half of this session, you'll have an opportunity to apply this entrustment scale to a few sample cases to help you explore the nuances of the scale. Next slide, please. Now, this slide provides a visual representation of the continuum of entrustment across pharmacy education and practice. And according to COEPA 2022, the assessment of students should be conducted prospectively. So in other words, based on what you've observed, how much supervision will be needed for the student in the near future? Or what level of responsibility is a student ready to assume? And what level of responsibility are you ready to assign to them as their preceptor? As we look at this continuum, students who are completing introductory EPAs would be expected to be at a level of either observe only or perhaps direct supervision. By the time they progress to their APAs or their advanced experiences, they should be able to perform at a level of reactive supervision upon completing their APAs and graduating. Higher levels of entrustment, including intermittent supervision or general direction, would be expected upon entering practice or during postgraduate training, such as residencies. Next slide, please. So in addition to where students are in the pharmacy education continuum, the level of entrustment also depends on the context within which the activity is performed. And so this is depicted in this figure here by Haynes and colleagues. So here we can see that the complexity of the environment and setting are depicted on the x-axis, while the complexity of patients and patient populations are depicted on the y-axis. So new pharmacy graduates should be able to independently perform all core EPAs under circumstances of low complexity, in terms of patients and environments. And as complexity increases, there's certainly a clear need for additional training and experience in order to perform EPAs in complex settings of care and with complex patients. So that's important for us as preceptors to keep in mind, since we may be supervising students that are caring for patients in these complex settings. And as we discussed before, under reactive supervision, we as preceptors entrust the trainee to perform the task without being directly supervised, but we remain readily available to step in and assist with cases or circumstances that are unusual or extremely difficult or complicated. Nonetheless, all pharmacy graduates should be able to independently perform all core EPAs under circumstances of low complexity. Next slide, please. So now that COEPA 2022 has been released, colleges and schools of pharmacy are at various stages of implementing the assessment of EPAs using these entrustment scales. So at this time, we'll have an opportunity to explore the states of implementation for the colleges and schools represented by members of our panel. And the information on the next few slides is also available in your handout. And we'll begin with Sharon Rush representing UT Austin.
Thank you. So if you can see, we're just in the beginning stages of implementing the EPAs into our evaluations of our IPI and EPI students. And ours actually apply to all IPI and EPI students. So we have a lot of work we still need to do. Now you can see if we really go by the college ratings, that's what our students are being evaluated on now. Do significant deficits exist? Are they meeting expectations? Are they exceeding expectations? That's the actual rating they are getting. But you can see where the levels of entrustment that we do have the statements that apply to those. Now you could also see there's some overlap. So we do definitely need to work on that at our college about getting it more in line with everything. So we do definitely still have some work on this. And also, you know, since this applies to both IPIs and APIs, the preceptors kind of have to adapt depending on if they're rating an IPI student or an API student. They have to recognize what the outcome is for that actual rotation and what level they expect the IPI or the API student to be at the end, and then adapt the ratings accordingly. So that's why we definitely need a little bit more work on this. So future steps are going to be realigning the EPAs and making them more of a focus on what our evaluation process is and evaluating them on the EPAs instead of the college ratings we have. And then we're also looking at, can we apply this to our pharmacy practice lab where we're looking at those skills and that we're evaluating those skills in our students in that kind of setting as well. So please, next slide, I'm going to turn it over to my colleague.
Hi there, this is Erin Johansson again from Roseman University. As you can see, we have been utilizing these general learning outcomes with the EPAs for many, many years now. So what we did was we tried to transition from a numerical grade into, or a number grade, into these trust statements that are focused on the preceptor's ability to supervise student activities. So as you can see, try and ignore the numbers. This was just for it to help our preceptors transition. At the very highest end of the scale would be someone who's probably in residency or already practicing independently. So you trust the student completely upon licensure to work independently, and that the student is qualified to give meaningful feedback to other learners for this outcome. So we often see this with residents who are precepting students as well as part of their residency. Most students by the end of the rotation will be at a 3. That's what we look at for our pass, no pass system. And that just means that you trust the student with limited correction and that the student is self-directed and seeks guidance when necessary. If we see that a student on a midpoint evaluation is getting a 1 or a 2, that might be appropriate for that point of the rotation, but by the end of it, we hope that they will not need frequent correction and direct supervision for all activities that they're a part of, or else we will intervene and they could result in a no pass grade for the student. Next slide.
So for MCW, something unique that we have is we use the entrustment scale to determine our EPAs for our preceptors. Unique to us, though, we do not offer a level 5 as a general direction. This is because it is known that this is not an expectation of our students to reach to. This is something more seen in a resident or a graduate. So level 5 or general direction is not even offered on our evaluations. Similarly, for our IPI students, the level 4 or the intermittent supervision is not even offered on our evaluations either. This is because we recognize that students are progressing and it's not something that we expect them to be reaching at a level 4 by the time that they're finishing their IPIs. So we kind of set realistic expectations and help our preceptors by making sure that our students are reaching the level that is appropriate for where they're at in their education.
So this is Amanda once again, and at the University of Texas at El Paso, we have implemented EPAs as the learning outcomes that we assess of our students in both IPIs and APIs, and we are utilizing the entrustment scale from COEPA 2022 with just some shortened descriptions to decrease word count. So the table that you see on this slide is actually what our preceptors see on the evaluation for our learners. And you'll notice that in addition to the levels of entrustment, we also have examples, statements of what preceptors might say to learners at various levels. So, for example, for learners that are at a level of observe only, particularly those students who are on an EPA, the preceptor might say to the student, let's talk about this first, or watch me do this, before they ask the student to perform an activity on their own. For students that are at a level of direct supervision, the preceptor might say, let's do this together, or I'll watch you. And then by the time they get to a level of reactive supervision on an APE, the preceptor might say, you go ahead and conduct the activity, and then I'll double check all your findings afterwards, and then we can discuss and I'll give you feedback. So these example statements are adapted from the modified Chen preceptor entrustment scale, and we've actually found them to be very helpful to our preceptors to help them interpret the levels of entrustment as they work with students. Next slide, please. So now that we've had an opportunity to discuss levels of entrustment, now we're ready to begin applying what we've learned and apply them to example cases. And so I will hand things over to Corinda.
Thank you so much. So if you're like me, I'm a really practical person and I need concrete examples. And so we've had a lot of information about the history of entrustable professional activities and defining those, but what does that really mean? And so I think a practical real world example is a good way to kind of get your head and arms around what entrustable professional activities are. So we give the example of driving the car. And driving a car is really a societal, entrustable professional activity, right? We have to demonstrate the ability to drive the car in order to get a license to operate the motor vehicle. It requires competencies, so we have to have knowledge. We have to know the rules of the road and what the signs mean and all of those kinds of things. We have to have skills. We have to be able to start the car, put on the accelerator, make turns, change lanes. We also have to have the right skills. So somebody who is has a lot of anxiety may not be a great driver. Somebody who has anger issues may not be a great driver. And so what EPAs do is really account for looking at all of those competencies. And yes, you may have some of them, you may have all of them, but can you put them together to actually do the thing, do the activity? And so in this case, the entrustable professional activity would be driving a car. So what we'll do next, and we can move to the next slide, is we're going to take a look at an example driver and see if we can determine what level we trust this individual at. So we have a 15-year-old student driver who's successfully completing the written test and earned a learner's permit. They're able to start the car, put it into gears, and do those kinds of things. They're able to drive the car down the neighborhood street just fine. They do express nervousness about getting into traffic or having to make quick decisions. And so next slide, now we're going to call upon you through our polling to rate this student's entrustability with respect to operating their motor vehicle. As we mentioned before, we have those different categories. You can refer to your handout if you want to refresh yourself on those details. But take a moment and let us know whether you think this student is in observe-only mode, direct supervision mode, reactive supervision mode, or supervision at a distance.
Hi, attendees. I've sent out the poll. You should be able to respond to it due to the number of attendees on the session. It might take a little bit to get to everybody. But if you're viewing this in full screen mode, you might not be able to cast your vote. If you exit out of full screen mode, that typically resolves that issue. Like Corinda said, please take a moment to fill out one of the 4 options, and then we will share the results live. That if you're viewing on the YouTube live stream, unfortunately, you're unable to participate in the poll. This is only for the GoToWebinar attendees. Okay, and I'm going to go ahead and close it, and we'll share the results. So we had 7% said observe only, 78% said direct supervision, 13% said reactive supervision, and 1% said supervision at a distance.
Okay, great. So we had some variability there. I think I'll go through what we as the panelists came up with for an answer, and then if you had something that was really different or kind of a question to explore in that space, make a note of that, and then we can come back and talk about these in a little bit more detail. So we really had this student at reactive supervision, probably for the first two elements. They're able to start the car and put it into various gears. They're able to drive the car down the street and seem to be able to do that and feel competent in that space. I think where the student driver is faltering is their ability to navigate in a little bit more complex environments, right? So they're worried about how they're going to navigate traffic and make quick decisions. So if we were rating that student overall on driving, we might rate them as a requiring direct supervision because they still had that element that they weren't able to complete in a more autonomous way. But if we were breaking it down into smaller kinds of tasks, we might see that they have, we trust them with reactive supervision to complete those elements of starting the car, putting it into gears, and doing simple driving tasks. So that's just kind of a real world example of how you might employ these entrustability scales. With that kind of introduction, I'm going to turn it over to Erin with some additional information, and then we'll circle back at the end with some pharmacy-based examples that we'll go through.
Great, thank you, Corinda. So as you can see, Roseman, we have tried to build in the learning outcomes. So that's, you can see, as educational outcome number 1, collect information to identify patients' medication-related problems and health-related needs. This is that one word, collect, that we saw from the domains earlier in the presentation. And this represents 4 different levels of students we have on community rotations. So that 470 just means they're a first-year student in a longitudinal community rotation. 572 would be our summer block rotation between P1 and P2. And then 570 is another longitudinal in the second year. And then APE students on their 6-week rotations is that 602. So all students at all levels should be able to collect a patient history. All right, so that is a check mark just of one example that preceptors should be able to supervise this activity for their students. Then, as you can see, there is a longitudinal progression with students where they begin to take into other medical considerations, utilize self-care, collect 2 patient histories with at least 3 comorbidities and 5 medications. Then as they progress all the way to their APE year, we want them to be able to triage patients based on presenting signs and symptoms, be able to analyze data from the patient, the prescriber, the caregiver, and then perform disease state-specific assessments if necessary. So blood pressure screenings, bone density screenings, strep tests, those kinds of things. On the next slide, you'll see assess. So think of that second one-word answer. Students assess information to determine the effects of medication therapy, identify medication-related problems, and prioritize health-related needs. So again, as a preceptor, you might say, well, what does that mean? So we are giving these bullet points, these EPAs, these entrustable professional activities, as examples of what students should be able to do at their site. So very beginning, first year introductory pharmacy practice experiences, they should be able to look at information in the patient history, right? They should be able to look for interactions, food interactions, and collect that information. As they progress, we want to look at, like, is this medication appropriate, right? What is the goal of therapy for each of the medication for patients that are on a lot of different prescriptions? And then as they progress even further throughout the end of their EPAs and into their APEs, really being able to participate in direct care for their disease state management of their chronic illnesses. If you go to the next slide, plan, again, these one-word things, plan, you'll see again how students can demonstrate to preceptors establishing patient-centered goals and creating plans. So again, very beginning, they would be discussing things with the pharmacist, look for items to intervene on, write an abbreviated SOAP note, and then as you get all the way down to their APEs, we want students to be working like they're ready for entry-level practice. So when you read these examples of what a student should do, it should provide guidelines on what a preceptor can trust the student to do at their various levels of learning. And then the last slide that I have is an institutional example. So we have our EPI institutional block and then our API 6-week block. So you can just see this is the one word educate, educating patients and professional colleagues regarding the appropriate use of medications. We would have an EPI student attend a P&T meeting. We would have them, help gather information, whether that's doing like a history and physical or a medication reconciliation if a patient is admitted from the ED onto the floors, do a topic discussion, however formally or informally that needs to happen. And then by the time they're an API student, the educate portion should be looking like leading a discussion regarding a journal article or manuscript, developing education programs for healthcare professionals, and really being more of a leader and educator in that role. So those are just some examples from Roseman, and I'm going to turn it over to Stacy for some examples from MCW.
Yeah, so one of the ways that we are actually able to track this longitudinally for our students is we rely on our preceptors to complete our evaluations. And so while preceptors are evaluating each item or each EPA, the Office of Experiential Education is able to see that progression between each EPI, each API, and then overall. So for example, here we have our EPI midpoint and final evaluation. You can see we have our EPAs, and then we have our levels of entrustment, our observe only, direct supervision, or reactive supervision for our preceptors to evaluate our students on. So we can see this over time with each rotation that a student completes, if they're progressing from that level observe only, level 1, to direct supervision, and see that progression. We then see that next progression in their APIs. So this is our midpoint and final evaluation for our API students, where we take those EPAs again and we have our levels of entrustment. So our levels 1 through 4, observe only, direct supervision, reactive supervision, or intermittent supervision. And again, the Office of Experiential Education is able to see the progression between each API and from EPIs to APIs. Additionally, we will use different assignments that preceptors will have to grade students on during a rotation to see a progression on specific EPAs related to a certain type of assignment that is given to them. So for example, here our drug information rubric has 2 EPAs specifically near the bottom there that we ask preceptors to evaluate our students on. So when a student is doing a drug information question on their EPI rotation, they might be rated as a direct supervision. By the time they're on their APIs, we would hope to see them more in that reactive supervision, intermittent supervision, and see that progression for us that way. I'm now going to turn it over to Corinda, who's going to go through some additional scenarios for us.
Thank you so much. So now we've had some examples about how to apply this concept of entrustable professional activities in a pharmacy-based setting. So what we want to do is we've got 3 different scenarios that we're going to go through where we're going to have the opportunity to evaluate the students with respect to some entrustable professional activities. In our first scenario, we have a student who's in their first week of community introductory pharmacy practice experience, and they're completing a drug utilization review. The preceptor determines that they're able to obtain the information from the pharmacy system and identify the issue with minimal assistance. They're not sure how to resolve the issue when prompted, and they're not comfortable contacting the provider to see about changing the prescription. So again, if we go to the next slide, there are several EPAs that we could look at in this setting. We could look at the student's ability to collect information and identify medication-related problems. We could look at their ability to assess that collected information and determine a patient's medication-related problems. And then we could also look at their ability to create a plan in collaboration with the patient and others trusted by the patient and other healthcare providers to optimize pharmacologic and non-pharmacologic treatment. These EPAs are pulled directly from the COEPA 2022 EPA list. So these would be ones that you might be called upon to evaluate in a student. So we will, we also have these scenarios listed in your handout. So we're going to put the polling question up. We're going to specifically assess the second EPA here listed in bold. So if you would, evaluate how you would entrust this student to assess information. You can refer to your handout if you need to refer back to the specifics of what that individual can do as you complete the polling question.
Attendees, so the poll is distributed out now, so you should be able to, access it shortly. I did have to do a slight, text abbreviation to the question just for a character limit. So you can refer to the handout for the full question, but I believe the intent of the question is captured in what's represented on the screen. So again, same thing as the first poll. I will keep this open for a few more moments, give everyone an opportunity to respond, and then we'll share the results. All right, with the poll being open for about a minute, I'm going to go ahead and close it and we'll share the results. 13% said observe only, 36% said direct supervision, 44% said reactive supervision, and 7% said supervision at a distance.
Okay, great. Thank you so much for that feedback. Yeah, and so I think, as our group looked at this one, we rated the student at reactive or intermittent supervision for collecting and assessing information. They seem to be able to do a good job of that. They could figure out what the problem was. I think their challenge came more with the ability to really decide what to do with that, right? Be able to create the plan and then operationalize that plan with a provider. So for EPAs 1 and 2, we rated that student as reactive or potentially intermittent supervision with collecting and assessing information, but more direct supervision in terms of creating a plan in collaboration with others. So again, if you've got any questions on those, make a note of it, and we'll be happy to discuss some of these nuances as we get to the Q&A session. For now, we'll move on to scenario 2. In the next slide, we have a student who's now on their advanced pharmacy practice experiences. They're in an ambulatory care setting. At the midpoint evaluation, the preceptor feels that they feel confident that the student can go into the room and conduct interviews with patients who have diabetes. They can perform a medication review. Afterwards, the student leaves and presents a summary to their preceptor, and then they have any recommendations approved before presenting them to the provider. During that activity, the student still needs some significant help and corrections when documenting their findings and making recommendations in the electronic health record. So if we go to the next slide, we can see that again that there are several EPAs that we could be assessing through this scenario. We can assess the student's ability to collect information and identify medication-related problems. We can assess their ability to assess that collected information and determine medication-related problems and health-related needs. We can assess their ability to create a plan in collaboration with the patient and others trusted by the patient and other health professionals to optimize pharmacologic and non-pharmacologic treatment. And then finally, we can assess their ability to implement a care plan in collaboration with the patient, others trusted by the patient, and other healthcare professionals. So for this example, we're going to focus on the number 1 highlighted in bold and ask you to rate your level of entrustability for this student on collecting information.
You got attendees. That poll is distributing now, so it should be there shortly. If you've just joined and you're having trouble voting in the poll in full screen mode, exit out of that, and that typically resolves any issues with that. So it should be hitting your inbox soon, and you can cast your vote accordingly. Again, I'll keep it open for about a minute, and then we'll go ahead and share the results. All right, everyone, and for the sake of time, I'm going to close the results now, the poll now, and share the results. So we have 3% said observe only, 11% said direct supervision, 34% said reactive supervision, and 53% said supervision at a distance.
Okay, great. So this is a little bit different response than we had on some of our others. We actually rated this individual at more reactive or intermittent supervision for being able to collect information. And so remember from our handout, intermittent supervision, I'm just going to kind of read that off here, is they're expected to perform this task with supervision at a distance. The learner can meet with the pharmacist at periodic intervals, and then feedback is provided. With general direction, this would be more where they're functioning completely independently. I would say that for the most part, we're not expecting that our students are going to be at that level of skill at this point in their training. So we, like I said, rated this individual as more intermittent supervision for that collecting information. We did rate them lower on assessing that information and creating and implementing the care plan, because while they were able to gather information well, they seemed to really struggle with how to pull that together, assess what was going on, and make a care plan. So they were more direct supervision in those other elements, but did seem to have a good handle on collecting information. So again, if you've got any questions about this particular EPA, make a note of those, and I think this will be a great opportunity to discuss in our Q&A session. At this point, we'll move on to our final scenario, scenario number 3. And here we have a student in a little more complex environment. We've got this individual is on a critical care rotation, advanced pharmacy practice, and they're able to write up cases and create care plans with minimal direction. They meet with their preceptor to review those plans at the end of the day. They've answered several drug information questions during the rotation. The answers have been complete and utilized primary literature. The responses during individual preceptor student sessions indicate that the student is very knowledgeable. When the student is on rounds, they are quiet. They make some suggestions, but they do require prompting from the preceptor for more complex recommendations. And so if we go to the next slide, we'll review the EPAs that we might be able to evaluate in this scenario. Here, again, as in our previous sessions, we can look at their ability to assess information collected from the patient's medical record. We can look at their ability to create a care plan in collaboration with others. And we can look at their ability to implement a care plan in collaboration with the patient and others. And then finally, this one is a little bit different. Contribute patient-specific medication-related expertise as part of an interprofessional team. So in this scenario, we're going to focus on EPA number 4 here, and take a moment and rate this student on their ability to contribute patient-specific medicated-related expertise as part of an interprofessional care team.
Again, attendees, this poll is distributing now, so you should be able to vote in it in a moment or so. Again, if you've just joined on and you haven't participated in a previous poll and you can't because you're in full screen mode, exit out of that and you should be able to vote accordingly. So we'll leave this open for a few moments. I do want to leave plenty of time for Q&A sessions at the end, so I might cut it off a little early. I want to give everyone a chance to respond now. All right, and I'm going to go ahead and close it out and share the results. So we had 3% said observe only, 25% said direct supervision, 43% said reactive supervision, and 29% said supervision at a distance.
Okay, great. So thank you so much for that feedback. I'll share with you what our group came up with respect to EPA number 4. We were relating them more as direct supervision for contributing their expertise. Part of our reason for that was that without that preceptor being right nearby, the student was more passive, only minimally contributing, and really needed that preceptor by their side to kind of prompt that engagement, which for us put it a little bit more in a direct category. We did think that for the other entrustable professional activities that were listed here, 1 through 3, the student was really doing very well and could be listed at intermittent supervision for assessing their information, and then maybe reactive supervision for creating and implementing a care plan. So with that, that kind of concludes our scenarios. We can move on to our next slide. Just want to share with you the list of references and materials that we use to pull this session together. And at this point, we want to open it up for any questions. We're going to bring the panel group back and open it up for any questions that you may have regarding the scenarios that we discussed or any of the content that we have today.
And attendees, before we start that Q&A session, I want to let you know that the CE information, that slide, will be shared right at the conclusion of the Q&A session.
Okay, so panel, we have some interesting questions. I'm going to start off the first question, which is something we really had not discussed within our group. And the question is, when we say learner, are we talking about to mean only pharmacy students, or are we going to also apply this to pharmacists working in the field as well over their entire career? Are there any thoughts on this?
I'm happy to take a stab at that question. So this was originally designed in medical education and followed the student through their initial years of medical school and then into residency. So pharmacy has utilized this similarly. I'm a member of AACP, ASHP, APHA, and we have utilized the term learner to mean both our pharmacy student interns in their first through fourth years of their didactic and experiential curriculum, but also those learners who may go on to do a PGY1 or PGY2 residency fellowship students. So ideally, you want to see more of those older students or more experienced students in the higher ends, needing less supervision and having more entrustability. But there are organizations, especially within ASHP, since they are the accrediting bodies and list everything of the residencies online, that are utilizing EPAs as well for residents. So I think it would be up to an employer to determine, a scale for people who are in practice full time and no longer formally learning, but it is an interesting idea.
It is, isn't it, Erin? Thank you. Next question. They would like to know if this is replacing the 4 roles of precepting. Anyone want to take a stab at that one?
Sure, I can comment. So this is not replacing the 4 roles of precepting, and I'm glad that question came up. And actually, I want to comment that COEPA 2022, in publishing the guidance document for colleges and schools to help operationalize the implementation of EPAs and their assessment using entrustability scales, have actually aligned the entrustment scale that we've included in your handout alongside the 4 preceptor roles, so that schools and colleges can share that with their preceptors to see how they connect. So for example, if you were to think about the levels of observe only, that would align with modeling, for example, right, in that preceptor role, whereas that general direction level would be aligned with that facilitation role of those four roles. So I think there's a very helpful crosswalk, if you will, between the two that is available and is published for everyone to access. And actually, I believe that's listed as one of the references on our reference slide. So encourage everyone to take a look at that.
Thank you, Amanda. The next one, the one that submitted the question says this seems to be a controversial point to them, and they would like to know where it is stated that the APE students should be able to perform all EPAs under reactive supervision in low complexity settings specifically. Can anyone address that?
So the slide from Haynes et al., that comes from the 2016 Academic Affairs Committee report for AACP. COEPA 2022 doesn't specifically state the example of low complexity as a comment related to reactive supervision, but we felt like those two were helpful to just provide additional context, because we recognize that questions can come about when you are precepting students in very highly complex environments. But that figure is in the 2016 AACP report reference that's on your reference slide.
Thanks, Amanda. I think it kind of goes along with another question that came up about for those of us that include levels 4 and 5 for EPAs and APAs, but we only expect level 3 from the students if our preceptors ever get confused. And do they just give students 4s and 5s even for the EPAs? I can tell you at least with our college, yes. We have our a lot of our preceptors, especially our EPA preceptors, exceeds expectations on our students. Whether or not it is accurate, we don't know. But we are in the infancy stages of applying this Entrustable scale. So I'm hoping that once we get some training behind this with our preceptors, they'll have a greater understanding of what those are. And we also need to change our expectations also on the student ratings. Does anyone else from the panel want to address this?
I'll just pipe in with our experience. I would say that we implemented EPAs in kind of a shadow format to allow our preceptors to get some experience with it. And we did some educational sessions. I think there was still a strong inclination to rate EPAs the way you would rate a grade. So if you had an A student, then you were giving them a 5. So I think we had a lot to overcome in that space. And so I think some of the changes to the COEPA 2022 help us to focus more on what we're trying to really get at and assess. And I'm not to sort of make, to throw a wrench in the works or put that out there, but I know at least in our space, we have had conversations about what should we do if we have students doing rotations in complex environments with complex patients. And I think that is a road that we need to travel. It may be that we would consider passing to be direct supervision in some of these complex environments. But I don't know that we have, at least on a national level, fully answered that question. I'll let others kind of weigh in that space as well.
Just to kind of add from the school that doesn't offer a level 5. So that was part of, I think, why we kind of set it up, of not, because I think the mindset a lot of times is that we get stuck on those numbers and everyone wants the A, right? So they want to be a 5, even though that's not realistic of where they're at. So by not even offering it, it eliminates that temptation. But additionally, because we are also a pass-fail curriculum, we also find that helps our preceptors to have more of a ability to kind of rate them on where they truly are. And it's not necessarily that they're gonna be at a 5, and that's okay. That's where we kind of see that progression, like Erin said in her slides, of seeing that progression over time. So we use those evaluations to look, and we hope that a student, by the time they're graduating from their APAs, isn't at a level 1 on some of these basic foundational type skills that they should be having.
Okay. Thank you, everyone. There's also a comment about that there is a struggle currently about preceptor understanding about an APA student that starts in May at the beginning of their rotations in their P4 year versus who is ending it, and that they are really not quite the same in the real world. And I would agree with that we do approach that a little differently, and our preceptors do kind of take that into account. Just like with our EPA students, the EPA students that start their community EPA in RP3 year in the fall are very different than the EPA students starting this spring EPA because of the pharmacotherapy modules that they have. So there's a different level of knowledge that they have. Does anyone else want to address that or speak to that, especially ones that may be a little bit more advanced in applying these?
Yeah, I would say that we would hope that in a non-complex environment with non-complex patients, that at the end of the rotation period, the students should still be at that reactive supervision phase. What I would envision is that maybe as students are, the later students, you may have them coming in at a higher level, and maybe that's a group that is coming out with more intermittent supervision. And I think Amanda had a really nice slide that showed that kind of progression, and that our beginner students are like advanced EPAs and beginner APAs, and our later APAs can be like beginner residents. And so there's a little bit of overlap there. But I guess my hope would be that within that 6-week context, in a simple environment and simple complexity, that they should be able to reach that that level of reactive supervision. That's just kind of my thoughts.
I think we just have time for one more, and then I know there are some other questions that we have not answered, but definitely the others will be submitted to us. But there are several comments about how these translate to grades. I can tell you, at least with us, it's pass-fail. So all of our EPA and APAs are pass-fail. We don't assign a grade. I don't think anyone in the panel assigns grades either, but I may be mistaken. Does anyone want to address that?
Well, I think COEPA 2022 has come out that EPAs for the most part reside in the experiential elements of the curriculum, and that EPAs are really a pass-fail element. So it does suggest that if we're grading based on EPAs, that we would be moving more towards pass-fail. I think there's probably some variety out there. I know we in Florida are looking at, through the consortium, going to a pass-fail system as we operationalize the EPAs.
And everyone, I'm sorry to jump on real quick, but it is the top of the hour, so I did want to stop the recording right now. So I'll do that on my end, and then we will share that CE slide. So the recording is now stopped. So if you could feel free to advance to that next slide with that CE information. So the access code is right there. It's 392714. You access it on aacp.learningexpress.com. We will also send information out in an email in case you're unfamiliar with the AACP system. So you will have that sent to an email later today once everything is done processing. So thank you everyone for attending this CE webinar. Like I said in that introduction and just now, we will have that processing information sent out to everyone who stayed the full length. You also have that code on the screen right now. If you have any questions at all, please email me at tmaggio@aacp.org. Please join me in thanking our distinguished panel for this webinar, especially for their time and insights, and I'll turn it over to Sharon Rush for any closing remarks.
Okay, well, thank you, Tom, and we hope this was a little helpful to you. As you can see, we're all at different levels ourselves and trying to figure some things out, and so we hope this kind of helped a little bit, give you a brief introduction to it and how you apply those. So again, we thank you for all of your efforts for our students, and we hope this gives you a little bit better way of accurately assessing them, because at the end of the day, it is trust. And how well do you trust that student to perform once they graduate from you on their own? So thank you again, and we hope everyone has a wonderful weekend.